quite a number of concerns that we really do need to address in terms of really ensuring that we're closing the gap. Now, what does this mean in terms of looking at equity and health equity? I think we always have to sort of make the distinction between equality and equity. And I think it's an important distinction because we are giving recognizing that there are differences in different populations and really tailoring the resources we're providing to what those populations need. I can't remember who it was. I think somebody said the difference between equality and equity is equality is giving everyone a pair of shoes, which is great. But then equity comes in when you give everyone the appropriate or correct shoe size for them. And so really in trying to address these gaps, I think we do need to put on a global lens. Sometimes the misperception is that disparities only exist in low and middle income countries. I think what we've all realized as a result of a pandemic, it's really shone a light on, the disparities that exist in any country, whether it's high income, low income. We have seen that there's definitely disparities. They are vulnerable or marginalized populations. There are people who are not having access to the services they need. And so we really need to do better collectively as a global community in order to address health equity and access to care. I think I'll leave you with a couple of closing thoughts. One, there is always hope, and it's important to really work hard to shift the narrative for our patients. Two, change begins with you. So don't look around for somebody else to make a change. You are the change. And I think it's important to realize that we can all make a difference. So spend time, reflect on this on this World Cancer Day, and really going forward, how can I use my influence, my skill set, really around my spheres of influence, around my bubble, around my social contacts, to really think about how can I close the care gap for our patients.